Okay, hello everybody who's watching. My name is Daille Held, pronouns are she, her, and I am a peer educator with counseling and psychological services.
Hi
Um,
everyone, my name is Lydia and my pronouns are she, her, and I am a wellness and mental health peer educator.
so since we are in the fourth week of school now, we wanted one of our introduction mental health Mondays to be on something really simple about mental health misperceptions that others may have, and then also as a way to give some information about counseling and psychological services for you all to use for the upcoming school year.
So, before we start bringing up different misperceptions and ideas about mental health, I wanted to talk about the harm of misperceptions because this is very important to consider. One big harm is increased stigma and discrimination against individuals with mental health concerns. When people have incorrect knowledge and ideas about people that have mental health needs, it makes it so these people are seen through more negative lenses, which isn't true and could be really difficult for those people. So, the second is reduction in trust of treatment and available resources. When people are stigmatized, they might not feel as comfortable seeking treatment due to personal beliefs that they've begun to hold about themselves and just feeling like others are going to judge them, which can be really difficult when this person does need more resources and treatment. Resources also may not then spread to a greater audience, and people can miss out on opportunities that could really help them and improve their mental well being. This also includes not searching for options when situations occur. And lastly, isolation of people that previously felt as if they needed treatment, leading to a lack in relationship strength and communications with others. When people do not seek the treatment or support that they believe can help them or that could help them, they don't end up feeling better mentally, or it's a lot more difficult for them to do so. This can lead down paths of isolation, which can reduce the strength of relationships and communication that they have in their life, which could further make it difficult for them to find resources. And removing and combating misperceptions makes it more open of a conversation, kind of going against the harm that it can create.
So we have a couple of myths that about mental health that we want to disprove right off the bat. So one is the main myths is that people with mental illness or mental health needs can't get jobs or do well in school. So this is a myth completely. People with mental illness and mental health needs can be just as successful in work or school as anyone else. I didn't list a whole bunch of celebrities that have mental health needs, mental illnesses, because I don't know, I find it to be a little bit corny, but they're out there. But not just like celebrities or artists have mental health needs. It's also just people that you wouldn't know have a mental illness or have struggled with a mental illness before. Um, like if you're a business major, there are plenty of business majors that struggle with their own mental health. I'm a psychology major. Lydia is a psychology major. People in the field of psychology also struggle with mental health sometimes. It's something that everyone experiences, whether it be just anxiety in everyday life, just trying to promote mental wellness and things like that. And it shouldn't prevent you from reaching your goals. And to reach your goals, we have supports available for you at University of Michigan-Dearborn. First is counseling and psychological services and the peer educators. Peer educators are mostly just there for mental wellness activities and just to have somebody to turn to if you don't think that your issue quite needs a counselor, but you just want some advice on everyday things. There's also disability and accessibility services, which will help you with accommodations And both CAPS and DAS, Disability and Accessibility Services, work kind of in tandem. CAPS provides clinicians, which can diagnose, and then Disability and Accessibility Services can take that diagnosis and give you accommodations, whether that be reduced distractions or extra time on tests due to anxiety. There's also TRIO Student Support Services, which is a new program that started last year on campus. They have a bit of requirements to join the program, one of them being first gen, another one being registered with a disability or just having a disability, which if you are going to CAPS, you receive a diagnosis, or you're receiving accommodations over at DAS, you can apply that to one of the requirements that TRIO has. And they just sort of, it's not just a community of support, but they can also connect you with resources in the community. They have resume building workshops and interviewing workshops, kind of like career services. But they also have other things like daily life skills, like stocks. They have a upcoming workshop on stocks and personal finance. The student food pantry is also a really great resource. A lot of times when you're struggling with anxiety or depression or other mental health issues, you might feel like you can't really get the time to cook for yourself or find food. And so the student food pantry is always there for you when you need it. And then also the CARES team. The CARES team is sort of a last resort. It's really an emergency service, but it is really good to keep in mind, especially you look as a person and a student on campus, having friends that are also students on campus. The CARES team has a website where you can put in information about somebody that you may be concerned about, and the CARES team will follow up with that person. It does not mean that they will automatically institutionalize your friend. That is not what they are for. They are there to connect whoever it is that needs support with the supports that they need, whether that be social services or just mental health needs that need to be met.
The second myth we wanted to talk about is having mental health needs is a sign of being weak. So this clearly isn't true. And the first aspect of that is mental health needs have nothing to do with weakness in general. When that word is brought up and assigned onto someone that may be seeking help or needs help, it really creates a situation where stigma is added, which, as I said before, is really harmful. And these misperceptions could really kind of create the situation a lot more difficult for the individual. Mental health needs just need to be separated from negatively connotated words in general that people may connect them to. It doesn't improve the situation at all, and it can be really difficult. So second is individuals of all different backgrounds and experiences use mental health services for a variety of reasons, and being too weak is never a reason for them. Mental health needs are found in all of these different reasons, ranging from just stress to needing greater assistance. And this really shows that needing that support with mental health is not something that's formed from weakness. It's simply just needing more help or just needing kind of someone there for you to listen and you'll be able to talk to. So support and resources themselves can be seen across dimensions, and sometimes it's just kind of having that one-on-one time to talk through. This doesn't make them weak at all. It just makes them someone who needs to talk and figure out a problem they may be facing. So this myth places shame a lot when it shouldn't be present. There's no shame in needing mental health support or just resources. Many children and adults receive assistance in mental health, and making it seem like they're weak does nothing but go against their support system, which could be damaging to them because they may feel more like ashamed of receiving that help when it's something that's kind of improving their well-being and making them feel just a little bit better in their daily lives. So feeling bad and ashamed for seeking help is not something that should occur. And you should never put that shame onto someone else, especially when it reduces the amount of people who need help, who need support, and don't seek it out for the reason of thought of as being weak or thinking of themselves as being weak.
So we get a lot of common concerns about going to CAPS. And so to address some of these concerns, we have the I can't go to CAPS because the first concern is I can't go to CAPS because it's too expensive or I don't have insurance. CAPS is completely free for students. It is paid for through your tuition dollars and your student fees. And no insurance is needed. They don't even ask you for your insurance. There's no billing to insurance. It is a completely non-issue. So if you don't want your parents to know that you're going to CAPS or your guardians or whoever, they do not have that information. And if you are an international student who does not have good insurance or doesn't have insurance, that is not an issue. I don't want my parents, teachers, or family to know. CAPS is completely confidential. Nobody can call CAPS and get information on you. They can't even say that you're receiving services. If somebody that you know outside of CAPS or your professors or whoever calls CAPS and asks for you, they have to turn them away. And if they give CAPS information about you, then CAPS can say that they can't confirm or deny if you're a patient, but that they will get that information wherever they can to wherever it to the person if they were a patient. There are also private rooms available for face-to-face sessions now or for virtual sessions. COVID is still a concern, and we know that a lot of students were apprehensive about going to CAPS when it was in a virtual environment where you may be at home conducting sessions. If you're still concerned about COVID, but you're on campus, then you can always book a private room and then Zoom with your clinician within that private room without having that face-to-face contact. I can't go to CAPS because it's only for short-term support. This is another really big concern. A lot of students say that, well, I need more long-term support, or I need a different level of support than CAPS can provide. And to that, CAPS can refer you to resources in the community. If you're sort of new to campus, but you live in this area, they can connect you to different resources to get the long-term support that you need, or things like testing come up a lot that people are concerned about, like autism spectrum disorder testing and ADHD testing specifically. And they can refer you to somebody that can do those tests. Another thing that comes up a lot is psychiatric medication, and CAPS does have resources for that as well. And also, if you're having difficulties accessing other resources other than CAPS, let's say that you have the issue in the first concern that it's too expensive or you don't have insurance, CAPS can continue to support you and work as a more long-term support system if you're having difficulties accessing those other resources. And then the last concern is that the wait is too long. This is a big concern, especially of students who have friends that go to U of M Ann Arbor. U of M Ann Arbor has a lot more students, and the students to staff at CAPS ratio, there's a lot more students than there are clinicians. But the thing is that CAPS at UM-Dearborn is not at all connected to CAPS at UM Ann Arbor. Ann Arbor students can't come to UM-Dearborn and see CAPS staff, and Dearborn students can't go to Ann Arbor to see CAPS staff. So CAPS at UM-Dearborn, for UM-Dearborn students, they will try to keep the wait list to 1 to 2 weeks at most, and will connect you with immediate support if necessary. If you are feeling like you're in crisis or you feel like somebody else, there is the CARES team that I mentioned before, and they can connect you with the CARES team or a clinician or whoever needs to be there for you. just don't wait to contact CAPS if you think that the wait will be too long.
So the last part of this that we wanted to talk about is stopping misperceptions and how can someone help? The first thing is just kind of be conscious of language and tone used when speaking on mental health from yourself and others. Using incorrect or negative connotations when speaking about these topics can reinforce stigma, even if it is done in a smaller way. Just using like the word weak when talking about mental health can kind of create issues in understanding what mental health needs are and what support is available. The next is showing compassion. Everyone's going through different stages of their life, and they may have additional needs or circumstances that you may not be aware of. So it's important to just recognize that you may not be aware of all of these and see that people are at these different stages that require them to have different needs from others. Simply being kind and respectful to everyone, regardless of whether they seek support or not, can go a long way to make someone feel much better if they were not beforehand. Treating individuals differently is not helpful in reducing stigma and making them feel comfortable. So if someone brings up that they're seeking support or they're thinking of it, just kind of showing compassion and being there without pressuring too much, or just like kind of showing the help they may need in a negative light. Just kind of be what that person needs you to be for the moment and support them through their process, because they have different needs that have to be met. So lastly, try to address stigma or misperceptions you hear from others if you feel comfortable doing so. Sometimes just having these misperceptions comes from a lack of understanding, and explaining to people how their statements may be incorrect or used in an incorrect context could help educate them and remove the perceptions that they themselves hold, and kind of reduce their bias that they may not even be aware of. So it's important to only engage in this if you're in a situation where you feel comfortable doing so. Never feel pressured if the situation that you're in just doesn't feel comfortable enough to have that conversation, or you can wait till you're in a better area to have it as well. And addressing the stigma does not mean shaming the person speaking on misperceptions, because like I said before, it really could just be from a lack of understanding, but rather maybe just adding in the conversation the truth behind what's being said could be helpful to them and to others around also listening in. So to help with this, researching different further misperceptions may provide you with some reasonings that kind of go against their biases and how it can be addressed correctly. So an activity that I wanted to do was, how would we feel comfortable addressing a misperception and ways it can be done? So the situation is you're having a conversation with your friend and they say that mental health needs are only for people with a diagnosed condition. So first, we can assess the conversation. Do you feel comfortable having a conversation about this? If this is something you're not really aware of as much as you'd like to be, maybe just kind of holding back until you find those resources, then reassessing the conversation might be best for you. Or just if you don't think that the place that you're at or the person you're talking to is going to take the information well, then maybe just kind of holding back from that as well. And then secondly, to what extent do you want to speak on the misperception? If you are somewhere talking to someone specifically that kind of requires a more direct or a more subtle need, then it's important to kind of figure that out and think about that before moving forward with the conversation. And lastly, I just put down a few ways to address it. I'm sure there's more if anyone has any ideas, but the first that I thought of is mention directly that you disagree and share your reasoning. So this is obviously a very direct way of doing it when you feel more comfortable. You could tell your friend that you don't believe that it's only for people with a diagnosed condition, and you think that there's people that don't really have specific conditions, but just needs some support, and they have some needs to kind of better their wellness. The second way is to explain the information that you know while not really commenting on the accuracy of their claim. So this is kind of more subtle, more indirect, but also acknowledging it. So kind of being a part of that conversation. You could mention some facts that you know or a situation that you've known about without being like too specific, where it kind of went against that idea that someone with a that didn't have a diagnosed condition went out and found some mental health support and resources, and it really helped them with the stress they had in their life. Lastly, bring up resources that provide more information on the topic. So you could, if you have some articles or you have a specific case that you've heard about in one of your classes that kind of targets that conversation and the specific misperception, you could bring that up to them. This is also a little more indirect because you're not saying that I think you're wrong. You're just kind of giving them a way to look more into it and kind of reduce their lack of understanding or bias.
Another thing about this is don't automatically be super confrontational with the person. It's very possible that they just don't know. And also, you don't want the conversation to become hostile, especially if you don't want it to. In this situation, you could ask some questions, like, for instance, if mental health needs are only for people with a diagnosed condition, then what should a person do if they haven't been diagnosed yet? Because a lot of times we talk about mental illness in very clinical terms, when mental wellness is something that we should all strive for. So that's the end of our presentation. If you have any questions or you think that you also need an increased level of support with your own mental wellness, you can reach out to UM-Dearborn CAPS at umich.edu. You can also call CAPS. The number is listed. And then you can also drop by the office. It's on the second floor of the UC. When you come in the front doors to the front desk, you go directly up the stairs. It's directly in front of you. The actual room number is 2157, if that helps a little bit better. So thank you everybody for watching. And I hope you all have a really great day and a really great rest of the semester.